Hi, my name is Allison LaRussa. I am a director of Health Humanities at the Wright Center. Primarily what I'll be doing is working with the creative arts with all the different programs here at the Wright Center. So basically there'll be an art therapy component to it, but kind of just coordinating left and right brain for everyone here. I've known Dr. Thomas for quite a long time. She actually asked me to come and do some art workshops here with the staff and some of their children the last few months, and she was like, I have a position for you that I want you to fill. My background before the Wright Center was the drug and alcohol mental health field for like the last 6 or 7 years. I got my CPS certification around 2015. Certified peer specialist is basically if you have a mental health diagnosis, then you work with that population. So I have seen the tremendous powers of healing of art through working in that field. Sometimes I don't think people want to discuss what they're feeling, so to have that opportunity to paint it or write about it, it's just easier for people to maybe process. It allows you to be mindful. When we're more mindful, when we're more present, we have less anxiety. So obviously when our body is anxious or stressed, you have that increased level of cortisol, and that creates inflammation in the body. So I think it kind of goes for both mental and physical. I use a variety of mediums with whoever I'm working with. Acrylic paints, watercolor paints, mixed media collages where they'll cut out magazines. I do like vision boards where people envision their goals and they use mixed media. Basically the possibilities are endless. Because art really isn't just painting. It can be cooking, it can be, the way you dress, it can be really anything. To me, anything could be creative. So I think how I measure success is when someone is able to find a piece of themselves that they hadn't before or didn't know existed. I had one client who every time I mentioned art therapy, she would roll her eyes. She was like, oh, I'm doing art therapy again? I don't want to do this again. This is not going to help me. As she was in the program for a few months, she continued to utilize art therapy. As she was leaving treatment, she thanked me because she was like, I really want to thank you for pushing me to do art therapy because it's helped me so much. My anxiety has decreased significantly, but she really just let herself go throughout the process and just kind of pushed through. And then it ended up, she was always asking me, when are we doing art therapy? Art was a very important piece of my recovery. I was very into soccer. I played in college. I tore my ACL, which was eventually how I got started on painkillers, which led to my addiction. Nothing seemed to help or work. And I actually didn't even want to go to treatment. So I was pretty much forced there, but I was happy I was forced because that was what saved my life. Yeah, art was definitely a huge part in my recovery. It always allowed me to feel okay with who I was and to feel accepted, to feel that, it was okay to be me. No other health center that I know has a position like this. And when I tell people what I do for work now, they're like, what does that entail exactly? They're just kind of surprised, which is awesome. I just think it's such a progressive, amazing thing to have the creative arts in a medical facility.